Hi, I'm Dr. Mayynk. I'm a board certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery, performing hair transplants in New Delhi for the past 12 years. Today we are going to talk about something which is pretty interesting. What exactly is a perfect hair transplant? Now, when we talk about hair, your hairline defines your face. It gives you the framework. It is something which is going to be visible to everyone out there. So a perfect hair transplant has to look natural. A natural hair transplant would be based upon what exactly is the level of your hairline, how the follicles have been arranged, and multiple other technical factors which we would be discussing here. Along with that, I would also be telling the USPs of what exactly we do at Crown to make it sure that your hair transplant is a perfect one. It is critical that your surgeon gives you adequate amount of time, explains every aspect of the procedure, assesses your realistic expectations, and if they are not so, then brings it down to something which is achievable. If you are on the same page as your surgeon, you will find your transplant to give you the kind of satisfaction that would make you feel that it is a perfect solution for you. A perfect hair transplant is supposed to have natural appearance, a seamless hairline, and optimal density so that the scalp does not become visible at any level. Just like the same food doesn't work for everyone, the same medicines don't work for everyone, one has to have a customized solution in terms of the kind of technique that is going to be performed so that you get the best of your results. In terms of techniques, what we perform at Crown, we perform the FUT, FUE, the simultaneous FUE procedure along with body hair distribution, and also the hybrid hair transplant where we combine FUT and FUE together. It is important that we have a sustainable approach when we are talking about a hair transplant. Now, sustainability of a result comes in terms of your longevity that you achieve out of a transplant. If you undergo a transplant and you have to probably consider a redo surgery or an additional session in about a year or two down the line, then the planning has not been done in an adequate manner. For someone who's having a rapid exponential growth of the balding area and it is increasing at a rapid rate, if at that stage of your life you're jumping in for a transplant, then it would definitely lead to a disaster. So in such circumstances, it is critical that your surgeon evaluates your hair loss progression and also simultaneously puts you on medications so that the baldness would stabilize. Sustainability also would be dependent upon what would be the kind of percentage of redo cases that a clinic is doing. So if a clinic is performing hair transplants, almost all the cases should be such which do not require any corrective process to add in density or change the naturalness of the hairline and give you a decent, stable result for years to come. Obviously, the tagline that is sold to you in terms of something being a permanent solution of baldness, definitely there's nothing which is permanent in life, and we have to be very clear about it that over a period of time your transplanted hair may also thin out and your baldness would also expand. So maintaining the results is critical with the help of usage of medication. Apart from this, the third point that comes in making your hair transplant totally perfect is the ethical way of performing your hair transplants. Now, when we talk about the steps of surgery which are supposed to be done by the surgeon, is basically any incisional step that is going to be performed on your scalp. Now, if you are going in for a process of hair transplant where major steps of your surgery are being done by the technical staff rather than the surgeon and they're not being monitored at all, then obviously we are going in for a failure or a kind of a result which may not be a perfect one. We have to make sure, like what we do at Crown, exactly all your incisional steps, extraction of your FUT surgery if you are doing one, closure of that FUT with a trichophytic closure, your FUE, extraction as well as the excisional step of scoring and taking out the follicles, your making of the slits on the recipient bed, giving you the angles, the directions, the density, the arrangement of hair. All these steps are usually performed by me alone. The only step which technicians are given to do is something where they can place the follicles into pre-made slits, which I have already done. These are steps which are approved by the Indian Association of Hair Transplant Surgeons as well as the American Board of Hair Restoration Surgery. The result would also be subject to the kind of doctor-patient relationship that you have with your surgeon. Your surgeon should have a one-to-one interaction during a consultation. Like for example, at Crown, we normally have a consultation which lasts for over an hour, where I do the clinical scalp examination, the trichoscopic analysis of the scalp as well, to make it sure that your donor recipient is in the form that would give you a decent result post surgery. We also take care that during that 1 or 1.5 hours of the consultation time, you should have the exact transparency of each step of this procedure, so that tomorrow, after getting the procedure done, there should not be any point which is missing in the communication. We make sure that the consent form, along with all the instructions which could be possibly affecting the results, are communicated to you and sent to you via an email much before your surgery dates, so that you have adequate time to go in and go ahead and read each point, mark your doubts, and then discuss it again with me. It should not be such that you enter a clinic for a hair transplant and you're about to enter the operation theatre and are just asked to sign a document and you go in without even knowing what exactly is going to happen inside. So in short, what you need to be very sure about is that all these steps, when we put together, apart from the technicalities of the procedure that a surgeon is supposed to perform inside the operation theatre, are going to be contributory to seeing to it that your hair transplant is a perfect one. In the end, I would like to summarize that what we need to take care of is the personalized approach and the customized solution of each patient who comes in for a surgery. So it should not be the same treatment that is going to be performed for everyone. Apart from that, the sustainability of the results, the longevity of the results, seeing to it that you don't jump in for a redo procedure or a corrective procedure, making sure that the technical aspects of each step is in place, maintaining the transparency, and all these things together will give you a perfect hair transplant. I hope I have addressed most of your concerns regarding what exactly could lead to a perfect hair transplant. I would also like to request you that if you have any questions regarding the same, please put it down in the comment box or contact the numbers given below. Thank you so much for giving your time to view our videos, and also request you to please like and subscribe the same. Thank you.